Mollie, are you on for Adam?
I am on for Senator Ebbin, who is still in committee at the moment. It says I can't turn on my camera, that the host has disabled that function, but I am here.
Okay. And Mollie, are you Montague? Is that how you say your
Yes, ma'am.
last name?
There we go. Hi.
Okay. And hi. And I think we're waiting for Dr. Avula. Are we taking questions yet, guys? Um, okay. Right. We're already getting questions in.
And if it makes sense, I have a couple of slides that may help illustrate the situation.
Yes, we do. Sure. Slides would be great. And I am waiting for Dr. Avula.
Yes.
But we're going to start exactly at 5. I had to leave a committee meeting, which I know is going to go on until 8 or 9 o'clock tonight. So I'll be presenting my bill quite late.
Yes, 1, 2.
Okay, Julia, why don't you send us the questions in the panel box like you're doing? That's great. All right. And we already have 88 participants listening. Or Jackie, have you let them into the room?
Yes, I have.
Okay, great. Okay. Dr. Varghese, welcome. And welcome to those who are listening and joining our Zoom town hall. The topic is on the COVID-19 vaccine. What is the state plan and what is the Arlington plan for getting these vaccines into the arms of our residents? I'm State Senator Barbara Favola. I represent a large portion of Arlington in the General Assembly. I also represent portions of Fairfax and Loudoun. Joining me today is Dr. Reuben Varghese. Dr. Varghese is our Director of Public Health in Arlington County. I worked with him when I was on the county board, and he is really considered a leader in the area of public health. My colleague, Senator Ebbin, is tied up in a committee meeting right now, but joining us from Senator Ebbin's office is Senator Ebbin's legislative aide, Mollie Montague. Mollie, thank you for being here. And we were just informed that Dr. Danny Avula is joining us, and Dr. Avula is a pediatrician by training, but more importantly for the moment, is he is the director of the state's vaccine program, the COVID-19 vaccine program. So welcome, Dr. Avula. I think we might as well start with you, Dr. Avula, because you can paint the picture at the state, and then we're going to go to Dr. Varghese, who has a couple of slides, and I think we're going to keep as much time as possible for questions. And I don't know if you all can see some of the questions that are already populating our chat room. But you are welcome. Go ahead, Dr. Avula. Welcome.
Yeah, sure. So good afternoon, everybody. I don't know how many folks caught the press conference this afternoon that the governor did, and I'll try to quickly summarize maybe some of the highlights. One of the things that has been really frustrating to many Virginians is their ability to get vaccinated, and their, the frustration of not knowing, how do I go about getting vaccinated? Now that I'm in 1B, I feel like I'm eligible, but I don't know how to do this. And I think that hopefully what people will understand is that our supply, our new doses each week, are severely constrained. We only have 105,000 new doses every week, and that's what we're using to set up clinics all over the state. And so we have a little bit of good news in that yesterday on a call with the White House, the governor was told that starting next week, we would start to see about a 15% increase in that weekly allocation. So a step in the right direction, but still a long way from where we need to be to get every Virginian who wants to be vaccinated protected by the summer. And so we will continue to distribute vaccine as efficiently as possible. I think that from the first few weeks when much of this vaccine went to health systems to now where there's capacity all over the state, I think that has been frustrating, particularly to communities like Northern Virginia that were receiving much of the vaccine, that we're watching, Innova and Arlington Hospital Center and the kind of big systems up there churn out vaccinations at a high rate, and then all of a sudden saw that really slowed down. And the slowdown in part was because we're getting a pretty fixed amount of vaccine each week, but in part because as other places around the state had built the capacity, we needed to really prioritize a more equitable distribution based on geography, based on, kind of per capita population. And that's what's happened. And I think that what it means when you're splitting 105,000 doses a week for the entire state is that we're talking about just a few thousand doses for each area. And I think that has been really challenging, particularly when being in 1B, when you take 1A and 1B categories, that represents 50% of Virginians. And so we have just a huge number of people who feel like, okay, it's 1B, it's time for me to get vaccinated, but there just aren't that many opportunities to get vaccinated. And so part of what we are doing is trying to help reset expectations, to help people understand where the vaccine is going, how it's being distributed, and when you might be able to expect your opportunity to get vaccinated. And so one of the things that was announced today was that, we'll continue this per capita distribution. 50% of whatever community gets will really be prioritized for the 65 and older population. We know that population is at highest risk for hospitalization and for death if they were to catch COVID. And so we really need to ensure that we get those folks vaccinated. The other 50% will be the continued work that health departments have done to work through those tiers of essential workers. So your police and fire, your correctional and homeless shelter workers, your teachers and childcare workers. And then in that, we will also include individuals who have underlying disease. Now, what it means is that it is going to take weeks and probably months to kind of systematically work through those priority groups. And so I hope that people, will be able to see that, to understand the challenges we're facing with doses coming into the state and be willing to still do the core things we know work to protect you from COVID and to wait patiently until it's time to be vaccinated. So that's kind of the first take-home message. I think there's also been a lot of questions about, we hear that you only have 105,000 doses a week coming in, yet we see on the dashboard that you've got 500,000 doses that are unaccounted for. And so that I think has generated a lot of consternation and confusion and frankly anger among people who say, why do we see such a mismatch yet I can't get vaccinated? The dashboard that we rolled out today hopefully does a much better job of helping people understand where those doses are and how they're accounted for.
And where is the dashboard? So if viewers want to know sort of for a point in time where the state is on the distribution and distribution per region, where would they go?
So the dashboard is on the Virginia Department of Health website. If you go to the COVID-19 page, there is a link that goes directly to it. And I just popped it. Oh, somebody beat me to it, Mollie. So yeah, I just popped that in the chat. But there's a lot of new information on here that both explain in aggregate, how many of these doses have gone to hospitals and health systems, how many have gone to other types of providers. And then the important part is the split between the first and second doses. And I think that really does explain a large part of why we see this 500,000 or so dose gap. So, and I'll quickly explain that and then kind of sort of pause for questions. But, imagine you're a health system and it's the third week of December. You receive 10,000 doses to vaccinate all of your staff. You've got 10,000 employees and so you receive 10,000 doses. You start to work through your staff. You get through, a few thousand in the first week. Holidays come, slows down a little. You get through more in the second week. But the administration happens over the course of 2 to 3 weeks when you get that many doses at one time. Now, you get your second doses 4 weeks after that initial administration on a schedule, because that's how the federal government had been allocating second doses on the 3 or 4 week dosing schedule. But those individuals that you just vaccinated last week have to wait a full 4 weeks before their second dose is due, which means that many of those doses, and in fact, right now across the state, 260,000 of those doses are second doses that are allocated for somebody over the next 1, 2, and 3 weeks.
So I think one of the questions we've been getting, and we're going to get to Dr. Varghese in a moment, but one question we've been getting is it wise for health systems to sort of hold back on their vaccine allocation to ensure that everybody they vaccinate will in fact get that second vaccine? Or is the state advising health systems to push out the vaccines? More production will be coming. Don't worry about the second dose. We will in fact be able to supply you with what you need. Mm-hmm. What would your answer be?
Well, in fact, we have been encouraging health systems and all providers to get out any doses you have for 3 weeks now. And understandably, a lot of our hospitals have said, we hear different messages from the federal government. We're not sure that we're going to get second doses. And so, I get where many of these health systems are coming from, right? Like they have a responsibility now to their staff and to their patients to make sure that they can provide a second dose. And they haven't been able to trust that that's going to come from the federal government.
That's right.
So I think what we have seen is now 3 consecutive weeks of consistent delivery, consistent production, and the federal government following through with those second dose allocations above and beyond our 105,000 first doses that we get a week. So I hope that now people have more trust and more confidence that they will get those second doses, that they don't have to hold those doses for their staff. And what has happened this week, I mean, in the last 24 hours, is that we've now had 6 health systems that have agreed to use second doses that were scheduled out for a couple of weeks to use them this week for first doses.
Great. I'm going to turn to Dr. Varghese and let him do a presentation, and then I'm going to ask you the questions that are popping up in our chat box. Thank you, Dr. Avula. Dr. Varghese, you said you had a couple of slides. Welcome. First off, our many Arlingtonians are on this call, and so we're happy to see you.
Well, I'm glad to be here and trying to help answer some questions, and I'll even be possibly asking Dr. Avula some questions because he's got the latest information since even this morning for me. So it says my screen, I can't actually share the screen, it's been disabled. So if someone could allow that, otherwise I can just talk to some of the points, but it may be easier for those who are visual.
Can you try it again?
All right, I'll
try it again.
Yep, It's now enabled. Okay, let's see. So this is the wordy version, and it's probably less accurate than it was earlier today, but the general concepts are there to maybe help people understand. They may not like some of the answers, but as many people know, the CDC and Virginia Department of Health have been following kind of a phased approach for vaccination because there was always the realization that there was going to be less available at the beginning, and then as more vaccine came online, that would be a way to take care of it. So the way it roughly works out is they think about those who are at-risk populations, and that's really those at risk for complications from COVID if they get exposed. Everyone's at risk for complications, but some groups are at more risk than others. And then the essential sector workers was a way to acknowledge that some professions have more risk of exposure to COVID than others. So in the first broad category 1A, you've got the long-term care residents, who I think everyone knows has had the highest death rates in the state, and that's no different for Northern Virginia and for Arlington. And then healthcare workers were more at risk for exposures because the sickest of the sick go to the hospitals and see healthcare workers, so they're more likely to expose people with COVID. Northern Virginia and Southwest Virginia were permitted on January 11th to go into phase 1B. And just so that people see, the areas in gray on both sides were groups that used to be in 1C, and I'll get to that. But for the moment, the original groups, 75 years and older, was the group for at-risk populations. And then on the essential sector side, the semicolons here matter. Every one of these semicolons is indicating, in a sense, the priority order when you have limited vaccine on how you invite those employers to send their groups in and to the health departments. And as things are available, we've opened it up more and more. So in Arlington, we, in addition to the healthcare sector, we've invited police, fire, hazmat, corrections, and homeless shelter workers. And most recently, last week, a week and a half ago, the child care and pre-K through 12 teachers and staff. On deck are these other groups, but we haven't extended anything. Given what we've had with Virginia Hospital Center having to make the decision, which I know was hard for them, to cancel appointments, they were receiving about 2,000 doses a week, or they were anticipating that, and we were getting about 1,200 doses a week. When it came to a total per capita allocation of 2,750, that was not something that was tenable for them. So we are now working on actually incorporating the 75-year and older group that were canceled appointments, and then to keep going with the other 75-year-olds in Arlington to get them into the system as well, roughly on a 50-50 basis.
Now, one question, Dr. Varghese, which is related to the priority. Folks are asking in the chat box if, individuals who work in the county and don't necessarily live in the county can also sign up to get vaccines in the county. Is that correct?
That's actually not how it's working. So the individuals sign up as individuals. The employers have to actually submit their status. So what we do is, for example, with police, it was easy enough with Arlington County Police Department to get their information.
Mm-hmm.
But what some others need to know is, because of our federal footprint, we have so many more law enforcement agencies than when I was in Three Rivers, which is the Middle Peninsula and Northern Neck 15 years ago. So each group will have different sizes depending on what's in their community in Virginia. There are going to be places you'll see on this list, food and agriculture. We have about 500 employees that we roughly, based on state estimates. That's like the poultry sector. Imagine there are other people that are going to have those numbers that are going to be much higher in their communities. So what we do is, when we get those employer group names, we send them and ask them who their point of contact is. Then we work with that person to send us their email addresses of all their employees so we can upload them in the system when it's time to invite them for vaccine. It's kind of an art and science. You don't want to invite the whole group at once, because it just creates so much frustration when we only have 2,750 doses available. So far, we've had no decrease in interest, so that's why we haven't gone beyond the childcare group. And given the allocations that we've had, we believe we're going to be able to introduce very soon the 75 years and older. We're crossing the T's, dotting the I's. My belief is you under promise and over deliver. I don't want to do the reverse, because people have been traumatized once already, and we're trying to reduce that trauma. I'm going to stop there for a moment before going on.
There was one other question, Dr. Varghese, on individuals who may be disabled or living in group homes, those with developmental disabilities.
So the group home categories are going to be related to what's being done with some of the long-term care residences, and we're developing more plans. And if Dr. Avula has anything further to say about that, I will defer to him, because he may know more than I do on that topic. But otherwise,
but they are they're in the 1A category.
I believe most of them are in the 1A. I don't want to, Danny, do you?
Yeah, that's correct. Sorry, specifically about group homes, right?
Yes.
So, the federal strategy for long-term care for nursing homes and assisted living facilities was to go through CVS and Walgreens, but there are a number of group homes that don't fall into that category and aren't being covered. Those are 1A categories. And so, and this is a pretty recent shift because the CVS and Walgreens had agreed to do some of those in the efforts to really accelerate nursing homes and assisted living facilities. They prioritized those, leaving many of those group homes to not be vaccinated in a timeline that any of us were comfortable with.
Okay.
So what we are doing
They're
is
in the queue. It's just that we haven't gotten to them yet.
Yeah. Well, so they are 1A, and we also have already given some vaccine, and DBHDS is working with some of the group homes that they oversee. We also are carving out some of the allocation to make sure that we prioritize those group homes. And then in some cases, depending on the district and what other demands they've got, they've been able to handle some of those group homes as well. So a bunch of different strategies. They're clearly 1A. We do need to get to them and prioritize them.
Okay.
So we are working so all of the people in green, Senator Favola, are groups we're still working with. It's kind of like we didn't completely finish with one group before you start working with the next group because there will be some delay in certain groups. So one of the things that I think goes back to what Dr. Avula talked about, and this was good through last Friday, I haven't updated it, but roughly we're getting 105,000 doses per week. These were the major buckets of groups that were receiving vaccine: the federal pharmacy program, the healthcare systems, typically hospitals, and geographically located populations, typically health districts, then allocating either to themselves to do all of it or with pharmacies and doctors' offices and so on. I will tell people very clearly, I have not decided to allocate to pharmacies or a doctor's office specifically in Arlington, because I don't want the population to have to find all the multiple places and trying to figure out how to get in and so on. We have the ability, we have been vaccinating at the Sequoia complex, and we've actually held events up to 1,000 people in a day. We have the capacity or the capability to run those things. Obviously, if we don't have that much vaccine, we're not going to run 1,000-person events when we'll run out of, we'll do it over a week. And we're doing it at least 5 days a week at the Sequoia complex.
I guess one of the questions has been, if somebody has already registered for the vaccine on the county website, the constituents talking to me is 70 years old, not 75. So I guess the county would contact individuals when it is sort of their turn to get the vaccine and set up appointments. Is that how it's going to work?
That is currently the plan. What we're trying to first do is deal with the situation with the 75 and older and get those dealt with. And I want Dr. Avula to correct me if I'm wrong, but we were going to do it essentially by age in a sense. We're going to first deal with the 75-year-olds before moving into the 65 to 74 group, but then that would be the next group, and doing it as methodically as we can. And DHS is actually leading some of that, the Department of Human Services, to make phone calls to people, to those who don't have email access and so on. So the county is working on those telephone systems to enfranchise those who don't have access to technology other than the phone or have difficulty filling out forms and so on. So that is the plan at this point. I wish I could give you more specifics right now, but they're finalizing those details.
That's terrific. Another question came in, or panelist Michael Leahy, two of the panelists, has a 97-year-old mother-in-law, and a caretaker who lives with her. Is the caretaker, who is a registered nurse's aide, is the caretaker in the healthcare worker 1A category?
So if they're registered with any authorized program, they would be considered a healthcare worker, and so they can sign up as individuals now in the healthcare category. What we did at the beginning, as all other places, we started with the largest systems first and then kept finding more. We did not actually have access to a list of all of these individuals, and so had to rely on people self-reporting, and then as we collected it, we've been adding it, and that's why we said there were those stragglers. But yes, that individual, if they're a healthcare provider for that individual, would qualify under the 1A category. We're not necessarily like suddenly saying they go ahead of someone else. It's just when there's a slot available, they can sign up. What we do is we send them a link to the CDC site when they get registered in our system, and they're invited. And then they'll also get access to a link for an Eventbrite calendar, and they will look each day, sign up for an appointment if there's one. It becomes a habit for people. They've been looking, and eventually slots open, and then they take the available slot.
This is a sort of an off the line question, but it did come to me as a constituent said, what if they could find some availability at a different site, either where they work or in a different part of Northern Virginia, even though they registered in Arlington for an Arlington vaccine? Is there anything that would prohibit them from registering to get a vaccine, say, in a different jurisdiction?
We are encouraging residents to stay within the health district system, and then employers the same. And that's how I will answer that.
Okay, very good. There's a question about daycare preschool teachers who are right now working because some of our families, parents are going back to work either 2 or 3 days a week. Schools have not yet reopened, so the teachers are still working virtually. And this person's wondering, are the daycare preschool folks, are those employees getting equal priority as the school teachers, or what's
Sure.
going on in that prioritization?
So, absolutely. So that whole category was one category, and so we actually got the list of at least the known childcare centers from the Department of Human Services, which actually licenses childcare centers. And then we also contacted all of the known schools in Arlington, got their lists as well, and uploaded it all at one time for those who sent it in. And then as stragglers have come in, those have been invited. And so, yes, they're all in one category, and they're all in the free-for-all for the slots as they become available. But that's why we haven't actually expanded beyond that. Some people may not be aware. The estimates vary from about 8,000 people to 15,000 people being just in the childcare and pre-K through 12 category for schools.
Okay, very good. We were joined by my colleague, Senator Ebbin. Thank you, Senator Ebbin, for joining us. We're just in the midst of taking questions. If you want to tell the folks what jurisdiction you represent, and then we'll go back into questions.
Well, I first want to thank Senator Favola, Dr. Varghese, and Dr. Avula for being here today. I represent part of South Arlington, south of Columbia Pike, while Senator Favola largely has north of Columbia Pike, and as well as parts of eastern and central Alexandria and southeastern Fairfax County. But I'm just here and happy that we can facilitate having some good questions answered. And I know that everyone's anxious to get vaccinated, so I'll leave it to the experts to do the talking.
Thank you, Senator Ebbin. Thank you for promoting this town hall as well. We had over 300 people sign up in one fashion or another. So there's a panelist who is saying, I am 79 years old and registered in Arlington County. When can I anticipate receiving my first dose? I guess the lack of supply is really concerning, because at the rate we're going, even those who are 75 and older, it could be 3 or 4 weeks before we get to that category. What expectation would you say to somebody who's 79 and waiting to be called for the vaccine appointment?
I think what you summarized, Senator Favola, is quite reasonable. It's probably going to be 3 to 4 weeks. I'm hoping it'll be earlier. I'm hoping it's not later. What some people need to know is the category of just 75 and older in Arlington is close to 10,000 people. Now, I'm hoping some of that is the long-term care facility folks, but trying to separate all of that out. So trying to set real expectations. We are anticipating, and Dr. Avula can just say how much, at some point, the supply should increase. But once again, and one of the slides I think people need to remember is, while 5 companies were selected by Operation Warp Speed to produce vaccine, and they could have vaccine on the shelf, only 2 have actually made it through the FDA process. So there's a pipeline, but until those vaccines from Johnson & Johnson and Novavax and AstraZeneca actually get approved, they don't exist at this point. So that is one of the frustrations that I think people know. It's like, well, didn't we do a lot? But we also need to have safe and effective vaccine. Dr. Avula, is there anything you'd like to add to that?
Yeah, I mean, I think, again, the recent White House announcement from a conversation yesterday that we'll have a slight bump in our allocation next week. So probably what that means for Arlington and I guess the surrounding areas is a few hundred extra doses. But Dr. Varghese is right that AstraZeneca, Johnson & Johnson, final phase of clinical trials, I think it's probably late March, early April before they finalize trials, get FDA authorization, and actually get distribution. That would change our supply significantly.
There's sort of three decision points here. First off, we're not getting enough from the federal government, and we're hoping that President Biden will invoke the Defense Production Act and we can really step things up. Point one. Point two, the state, I hope, is dispersing the supply as quickly as we get it and as efficiently as possible. So we have to work on that. And then step three, once the county gets it, they have to be efficient in getting it into people's arms. There's a comment here that an individual is saying vaccines, of the 3,000 that were delivered to Arlington County on December 23rd, it took the county 10 days to get about half of those doses into people's arms. So are we getting better at the flow here?
Part of it was the initial getting the information out to people and getting them registered. Last week, out of the 5,000 first doses we had, we roughly put out 4,500 so for a total of 90% rate, and we held a few doses to make sure we had enough for our Monday clinic in case there was some sort of supply delay and so on. So enough for that first day. So we're proud of 90%. We're hoping to push the envelope and make it even 95%. We are doing what Dr. Avula is hoping for, and we are taking some second doses and likely to be advertising a clinic for the people that have already been invited, not for the rest. That's why I need to manage expectations. And we hopefully will have another 1,000-person event this weekend for those groups to try to get more out there, and just hoping that we'll get the second doses in time for the second doses, because we still have an obligation to do this correctly for those who got the first doses.
Yes, you do. I have to say, folks are very anxious if they've signed up, and they're going to be waiting weeks, 3, 4, 5 weeks. Some folks may think they dropped off the radar screen. Are we going to send periodic notices to constituents saying, we know you have registered, you're still in the queue, we are waiting for the supply, just so they know that they have?
I will take that back and see what we can do as a county to support that. Our first goal is to try to correct what happened last week. It was no fault, I think, of anyone other than the circumstances, and trying to make sure that those folks who actually were 75 and older who were scheduled, my staff with the rest of the county are working on a plan, and hopefully there will be an announcement in the next day or two of when that scheduling will begin and so on. So that's been our first priority. And then obviously making sure that we can figure out a way to then keep people appropriately updated, saying you have not been forgotten, which I realize is a hard thing to do, especially for those who don't have email access and so on and get registered. So we'll try as best as we can to inform people.
Okay, that would be great. An individual asked, what if I miss the email notification to make an appointment for a shot? Do you send out a second email, or do they fall to the bottom of the list?
Not knowing exactly what the context is, here's what I'll tell people. So once you get the invitation from us through the CDC VAM system and the county scheduler, yes, you should be checking your spam boxes and so on periodically, especially if you know that your group has actually now been one of the groups indicated. So I don't have another way around that, but for folks to actually look at their spam folders and so on, because sometimes we're finding out that official emails get the various systems may think of it as junk mail, and it actually is what happened with the school system, because their filters are so tight appropriately for security reasons. When that many county emails come to a particular server, they think it may be a spam attack, and so it was sequestered for a while. So some of our technologies to protect us from X have other consequences. So my advice is, please look at your spam folders if you're expecting something, to make sure that something hasn't been misdirected.
And the county will do a good job in ensuring that information is out,
Right.
county website's updated, individuals have a place to call if they do have questions.
They are currently asked to call the 799 number if they absolutely have questions. But our website keeps, I mean, I think it's been changing every day to due to suggestions. It could look this way, it could look this way to make it cleaner. So absolutely right, Senator Favola, look at our website for information as well as the state website.
Senator Ebbin, did you?
Yeah, I was just going to say that one of the questioners asked what the email would come from. What address should people be looking for, and is it consistently the same address?
It is consistently the same address. I wish I could actually tell you off the top of my head. I will have to send that to, I think it would be to Senator Favola, and then hopefully we can get that out to folks so that people can actually look for that address.
Yeah, that would be great. Senator Ebbin, do you probably have some questions from your constituents? Not that they're identified here, but feel free. I may have.
Okay. There was one question about the first responders who may not live in Arlington, if they should be vaccinated in their home county or if they get vaccinated in Arlington. Is there a policy on that?
So here's my understanding, and it's been vetted, I believe, throughout the three states. The policy is, if you're signing up as a worker, you do it in the jurisdiction that you're working in. If you are doing it under, say, your 75-year-old EMS worker, then you have the option in your locality here in Virginia to sign up in your jurisdiction of residence as a 75-year-old. So you could potentially be in both, but the worker situation is based on which locality you work in, not which locality you reside in. Danny, anything that you'd want to add to that?
Dr. Avula, do you have any comment on that?
And you're muted.
Sorry, I'll play it. Yeah, I think what Dr. Varghese said is right. I mean, we are trying to do employer-based clinics, and we have a pact with the three states, or DC, Maryland, and Virginia, that was just reiterated by the governor earlier this week when this question came up. And so, you know, everybody should be not worrying about residents too much. This is a federally funded asset, these vaccines. And so we really, we don't want to be sticklers about it, but there is a plan to primarily vaccinate, through employers for these closed pod clinics, and then for other categories to do it in your place of residence. And I think the way that we've chosen to handle that is knowing that there may be some ebb and flow across county lines, and if it becomes a larger problem, then we'll need to be more restrictive. But to date, we've really allowed for a little bit of flexibility there.
But by the employers, we're talking about employers of our essential workers.
Correct. Yes. Sorry.
That's what we're talking about. Yeah. I mean, police, fire, healthcare workers. We're looking at those employer circles. Okay, we had touched on that a little bit before you came, Senator Ebbin, but thank you for reiterating that.
Well, if I can just pose one more,
Sure.
Senator.
Yeah, sure.
I want you to correct any misinformation in the question. I'm going to read it as it was written to me. The question is, if there are long-term effects to the consequences as a result of the vaccine, someone wants to know if there's a remedy. First, could you address, are there consequences, potential side effects of the vaccine? I'm just relaying this because a questioner wants to know, and I think it'd be good to give them accurate information.
Start, and I'll let Danny add anything on Dr. Avula as he sees fit. So in general, what we know about the vaccine, it is safe and effective. The FDA and CDC independent experts reviewed it, and they're the ones who recommended to both agencies that they felt it was safe and effective. They followed it for at least 2 months, and the expert advice is that usually you see the significant side effects in the first 2 months of any vaccine trials. And so it was in that sort of respect that that was done. Obviously, just like any other vaccine, they're going to be followed over years, just like all the other vaccines have been. And so the side effects that really have been noticed are the temporary side effects following vaccination, things like sore arm, fever, fatigue, and muscle achiness, and so on. There have been, of course, as you've seen, reports and real evidence of, a few allergic reactions. That is not surprising. It's quite rare, less than 1 per 10,000. And what people need to realize is, I think people are putting vaccines in a different category than they should, because antibiotics also have side effects. And in fact, there are a number of people you may know who have known allergies, including significant anaphylactic reactions to antibiotics. We have not taken antibiotics off of the market. We then say this individual shouldn't take it anymore, but it works for the vast majority of individuals. So from that perspective, we also believe it's safe. Obviously, they're going to follow over time to see any other things that are noticed. And unfortunately, there was no way to test this for years before, because I would make the argument, if we knew coronavirus was coming, why didn't we stop it? And so this is just one of the things where we've had the virus around for about a year and a couple months. And the vaccine actually being developed this quickly is remarkable, but it's not old technology. I mean, it's not new technology. It's actually been around for a while. It's actually been used to develop things for Ebola and MERS-CoV. Dr. Avula, anything you'd like to add?
Covered it pretty comprehensively. No, nothing to add.
There's 2 questions I want to make sure we get to, and each panelist may want to respond. What about healthcare workers who are unaffiliated with an organization? So again, you might have home day workers, or those who, are licensed but may contract out to provide, assisted living services or things like that. What would you? They're home care workers. They come in contact with our most vulnerable, but they may not be affiliated with an agency or a healthcare agency. This questioner would like to go someplace other than the county. They should like to go to a drugstore. Like, would she be included in the federal long-term care program? Could she go to a Walgreens to get a vaccine?
So I'll take a stab at it, and let Dr. Avula.
I think Dr. Avula is going to have to answer this too.
So for the basically self-employed healthcare workers, we actually have it on our website as part of one of they can sign up essentially as a self-employed individual. So that's kind of their organization. We didn't start back in December that way. We've modified it to include those as well. So home health agencies have been added, and so on. So anyone who's a solo healthcare practitioner, if you go to our website, they can identify themselves that way, and then they'll get contacted and uploaded in that way. That second part about what we're doing here in Arlington anyway, as I've said, for Arlington, given the limited doses and the fact that I don't want it to make it any more difficult for people to find vaccine in Arlington, we're only 26 square miles. I realize some people believe that's a lot. I came from a health district 15 years ago that was 2,000 square miles. On that scope and scale, I want to make sure that the vaccine is held properly. This is precious vaccine. I don't want there to be accidents with the vaccine because of temperature control. Currently on this campus, we're able to see at least 1,000 people per day, and we don't have enough for 7,000 doses this week, unless Dr. Avula wants to make Arlington a special place, because we know we're his favorite.
You know, Arlington rocks. Yeah.
Exactly. So I'm not going to ask him to say that out loud. That could get him into trouble elsewhere. But so what my point though is we're trying to be both effective and efficient. So yes, unfortunately, it means you will not be able to get vaccine at doctors' offices or pharmacies in Arlington, because we're trying to make sure that we're most efficient and effective with it right now. Long term, absolutely the goal is to have it available everywhere. But when it's this limited, it does not make sense to have like 100 practitioners with 27 doses each, because it's going to be really hard and it will disenfranchise the very groups trying to find it, because they don't know where to go, because it's going to be very hard to manage.
Yeah, and I would say that distributed model, that even in the month and a half of vaccine we've had, it's gone from large providers to a bunch of different clinics. We have 840 different sites at this point across the state, and that distribution has actually made it incredibly difficult to maintain data accuracy and data quality. I think when you look at the states that have statistically done a much better job with this, it's that they've held tight control and minimized the number of channels that vaccine is coming through. And I think at this stage where we have limited supply, that is really important. And I imagine that will continue to be the case over the next few weeks, when we're primarily feeding large-scale health department clinics that have high output, and health systems that are able to do that too. As we look forward to a time where we have much more vaccine supply, getting that more distributed model will be really important. And so we are preparing for that by making sure that our pharmacies and providers are working through the steps that they need to become approved CDC providers, understanding cold storage, understanding, VIS data, the database entry. Right now across the state, we've got 420 pharmacies that have been onboarded and over 2,000 provider groups. And so, as vaccine supply increases over the next few months, and as we are able to better support all of those different channels and make sure that the vaccine is both given safely and that the data is collected accurately, that we'll see that start to happen. I think to the original question of the sort of home health provider, the way that Dr. Varghese described Arlington is handling is how most of the state is, that would be considered a 1A provider. They would need to register through their local health department for a 1A clinic. The long-term care partnership for pharmacies, CVS and Walgreens doing assisted living and nursing homes, they would not be able to access through that partnership, because these are not, CVS and Walgreens are not doing this in their retail stores. They are sending teams into nursing homes and into assisted living facilities and doing on-site vaccination for their residents and staff. And we probably won't see it in CVS and Walgreens stores for a couple of months, maybe mid-February, I think, is when the part 2 of the federal pharmacy partnership opens up, and we'll be able to channel vaccine into different pharmacies.
And
I want to make sure, there's someone who just posted, Arlington is not getting 105,000 doses per week. That is the whole Commonwealth's
That's the Commonwealth,
allocation.
right. Which is why this is going so slowly. So we really do have to increase the production at the national level, and Virginia needs to get more doses. We have 8 million people in Virginia, and actually 50% of our population, I believe, is in either category 1A or 1B. So we need those vaccines. We need those vaccines. And I know Congressman Beyer is working to set up a distribution center in Arlington, which will give you one other thing to manage, Dr. Varghese, but it'll also give our residents another touch point. In Arlington, which it was very unfortunate, but Virginia Hospital Center had expected to get a certain number of doses. They had made appointments for patients, and then at the last minute, the state informed the hospital that the doses were going to the county. That caused a lot of consternation, because then people had to get cancellation notices, and it was very distressful. And I can understand. I mean, you're very worried, very anxious, and you get that precious appointment, and then you're being told it's canceled. So, Dr. Varghese, the folks who had appointments at Virginia Hospital Center, are they being prioritized into the appointment system that the county has?
So, Senator Favola, yes. Whatever the reason, I'm just going to say the reduced doses, and that's really what we should focus on. And so several hospital systems have actually canceled these appointments. And so what we did is we've gotten the list of names from the hospital that were registered 75 plus who are Arlington residents, because that was what we asked them to do with the supply that they were expecting. So that is what we're first working on, to get those individuals into appointment slots. That's what the staff are working on. They've been working night and day with the rest of the county to figure out how to do this and allocate it appropriately. So all I can say right now is stay tuned, but those are going to be the first 75-year-olds, because that was part of the official program that we had done. We have to first get through that's a list of about 3,000 individuals. So we have to get those individuals, and then we have others. For those who have not signed up yet, there's the registration link on our website to be able to then register as pre-register as a 75-year-old. There are links for 65 and to 74 and 18 to 64 with medical conditions. When those terms come, we will have to invite people in similar ways. And so those are the things that we're working through, and basically every jurisdiction in or health district in Virginia is working through those processes right now.
Well, I can appreciate that. I mean, this is just, to me, it's got to be a scheduling nightmare, especially when the supply is so limited. So, I mean, Dr. Avula, if there's anything we can do, I understand the public health model, having the county and local public health units sort of control the distribution is probably the best model right now. We can keep it efficient and make sure the supply gets into folks' arms quickly, as opposed to just a provider getting 27 doses. Or I get that. I understand why we're doing it. It just seemed, the transition seemed very abrupt. That's my only, and I don't mean to lay blame at you, but the transition was very abrupt.
Yeah, no, I hear that. Obviously, I've been on the phone with CEOs of health systems every day, all day for the last couple of weeks. And the reality is that for the first 3 weeks or so, the hospitals were the ones who had the 1A healthcare workers and the ability to get out vaccination in large scale. And so they were receiving large amounts of vaccine, not with any guarantees, but just because they were ready and could get it. And so what happened last week for the first time is that we had more dose requests than we had doses that we could allocate. We had 300,000 doses that were being asked for, but only 105 that we could allocate. And so I think for a lot of the hospitals, that was a shock to the system, right? Because they'd been receiving thousands of doses for the 3 previous weeks. And then had kind of scheduled out appointments. And so, you know, obviously I think that if we were able to give them a couple of days more of a heads up, but we were, you know, every week it's kind of down to the wire about where the doses are going to go. And I think that at this point, what we've tried to do is now give people a 3 to 4 week planning window so that doesn't happen again. Now it's still a small allocation because it's got to go through the whole state. But I definitely both understand the frustration of my hospital colleagues, but also of the patients who had to have those.
Yeah, they were very, very stressed because they thought they were all set. And now they, now they're, feel like they're in a shuffle. I have an interesting question, and I guess this goes back to Dr. Varghese, and I'm sorry, we're really putting you on the hot spot, but we only have time for probably 2 or 3 more questions. One of our panelists said that if the email was coming from AOL or Verizon, it wasn't likely to get through. I hadn't heard this. Is there an assurance that individuals will receive notification? I mean, we went through the fact that they should be checking their spam folder, but are you having trouble with any specific email addresses?
So great question. Actually, the county is aware, and they're working with those service providers to try to have them not recognize it as spam, because any certain volume, and I can't tell you how much it is, but when they see certain numbers of emails. It's just what happened with the school system. They will often make it look like spam or deny entry. So the county is working on those. That doesn't mean if you've been in the registration system that we didn't get the information. The problem is you may not have the
Dr. Varghese?
Hello?
Hi, you were frozen for a moment.
Oh, yeah, it just said my internet connection is unstable. Okay, that's not good. And I'm working for the county government, so so these things do happen. So the county is working with those internet service providers to know that. That doesn't mean we don't have the information, and using the 799 number would be reasonable to see if there's a way to find out, to get back to you on whether or not we actually received it. But it does not mean you if you registered, you should have entered it. What you just didn't get is the email that got generated by the company that has that product, because it may be looked at as spam, which is unfortunate these days, and it may not even allow it into the system, which is unfortunate. It's for a right reason at the wrong time.
Gosh. Well, we really do need to find a way to keep communicating with folks, so we appreciate you working with the companies. Another question, if an individual has to have an appointment rescheduled, would she end up going to the same location as the first?
A great question. First of all, I just want to remind everyone, anyone who received their first dose as a 75-year-old from Virginia Hospital Center will be able to get their second dose, according to them, at the same site, which is the Walter Reed Community Center. The Arlington folks, 75 and older, who were canceled by Virginia Hospital Center, we have those names, and as I said, we're hopefully going to announce something in the next day or two on what that's going to be. They will be served currently at our site at the Sequoia complex, which is right near the Fort Myer area on Washington Boulevard. So, and there's actually a parking garage. In some ways, in that sense, it may even be better than Walter Reed, but that's the current plan. And then longer term, we may have different sites, but we don't want to expand beyond our current site until we have much more vaccine. And then likely we may have two sites. We're not going to have one site at that point. I suspect we'll have at least two sites trying to run at least 1,000 doses per day. Our goal is when we have the vaccine to be able to do 2,000 doses per day, which would be up to 14,000 per week.
That would be wonderful.
Yes.
That would be wonderful. Let's strive for that. Okay, we have time for just one more question and then maybe closing remarks from our guest panelists. Let me see if there's a question here that now we answered the question, if you're 65 and older, we're thinking it's going to be maybe a 3 to 4 week delay in actually getting the vaccine in people's arms.
I'd say 75 and older. I don't want to say 65 yet, because that's another 15,000 people in Arlington just from 65 to 74. So if we get more, absolutely, we can go faster. But at the current rate and relating to the other groups on the frontline side that we also have to do, I don't want to make a promise too early because I think people get disappointed when we say it's next week and it doesn't happen. So I wish I could actually provide more hope in that sense. Let's do it at, as I said, there's limited supply and we're working as quickly as we can to get out the doses we get during the week. I'd like to maintain 90 to 95% delivery of vaccine every single week.
That's great. That's wonderful. What we ask at this point really is that Arlington keep our constituents posted and updated as much as possible, whatever you can put on the website. And for folks who are, again, have registered but are not likely to be scheduled for maybe 8, 10, 12 weeks out, letting them know that their registration is still valid periodically, I think would help. We really appreciate the hard work you are doing, Dr. Varghese. I can't imagine how challenging it is, and a number of hours and the stress. And so we really are very happy that you're serving us so well. And we really, really are very, very grateful for your work here in the county. And Dr. Avula, we are very grateful for you as well. We know that you have a lot of alligators sniffing at your heels. It's got to be a challenge. People are so anxious, and I know that it's quite a mosaic in the Commonwealth, all different healthcare systems and different needs. But we appreciate your leadership very much on this issue, and we are hoping you'll be a strong partner. We'll be right with you in the General Assembly. Do either of you have any concluding remarks?
I'll just say this. Thanks, Senator Favola. It sounds like you might be trying to squeeze a little more vaccine out of me. we will get it to you when we can. But no, I think I think for everybody listening, hopefully understanding the constraint that we're facing and the limited supply will allow people to say, okay, I can take a deep breath. I'm in 1B, yes, but I understand that it may be months. And I hope that societally, we will really allow those who are most vulnerable to get to that front of that line and allow our elderly to get vaccinated first and protect those lives, and be willing to do all the things we know we have been doing and will continue to do to keep ourselves safe until we can get vaccinated. So just encourage everyone to look out for your neighbor and make sure the folks who need it most get it.
Yeah, and to keep wearing our masks. I'm told even if you're vaccinated, you may still be a carrier. So we have to keep wearing our masks. So, and we are nowhere near herd immunity yet, right? Wouldn't you say that, Dr. Avula? So thank you. Dr. Varghese, any closing remarks?
In addition to what Dr. Avula said, just thank you for having these forums. As much as possible, getting good, accurate information out there is important. And it's only half joking. If there's any way to incent Pfizer and Moderna to build their plants in Virginia, maybe that is something that could be done, and say, we want at least 50% of those doses to remain in Virginia for the next 3 months. It's a small price to pay.
Yes, we have to get the supply up. We absolutely have to. Okay, thank you. And thank you for all those who asked questions. We still have them in our chat box. We will, Senator Ebbin's aide, Mollie, and my aide, Julia Chun, will try to put them all together in some kind of orderly fashion, and we will attempt to get answers to you, and we will post them on our websites. So we will do, I will do a frequently asked questions page on my website with official answers to your questions, if you can get them together. I guess I'm speaking to Mollie and Julia. And I think Senator Ebbin would probably want to do something on his website as well.
I do believe his last weekly roundup email was about vaccinations, so that'll be up on the website soon, so you can see that there. He does send out a weekly bulletin, and we will I know I have spent most of the day fielding calls about vaccinations and have FAQ sheets prepared, so we might be able to get something up like that as well.
Thank you. Thank you to all. Stay safe. Have a